Good afternoon, everyone. My name is Kate Romano. I'm the CEO of Stapleford Granary Arts Centre, which is about 5 miles from here. And I'm also a classical musician. So I've not been involved in this project at all. I'm kind of the outside ears and eyes, but it's been an absolute pleasure to come into it at this late stage and find out more about it. We're here to talk to you about a project which took place in April this year, where, as Natalie said, musicians from Britten Sinfonia came into the intensive care unit at Addenbrooke to play live music and enhance the environment for patients and their loved ones and staff. Now, Britten Sinfonia, as Natalie said, has been involved with CUH Arts for some years, and musicians working in hospitals isn't new. There are similar projects up and down the country, but this project was bold and different because of the nature of intensive care and the seemingly incongruous idea, or so it seemed to me to start with, of bringing live music into what might be a very challenging environment. So our panel members here today are clinicians, musicians and producers, and they're here to talk to you about the successes and the surprises, the difficulties and the delivery of this project and what made it so extraordinary. As Natalie said, we do welcome questions from the audience. We'll have a chat first and then we'll come to questions a little bit later. I'm going to introduce the panel first, starting at the far end. Akua Obeng-Frimpong is arts producer at CUH, and all her professional roles now and previously have placed engagement, support, opportunity, access, advocacy at the heart of creative work. Next to her is Sam Glazer. Sam is a composer, a cellist and a workshop leader. He describes his work as creating spaces where people can come together and connect through music making. He's worked alongside professional and non-professional musicians in community and healthcare settings, and he's got long-standing educational relationships with Peasmarsh Chamber Music Festival, Spitalfields Music and Wigmore Hall, and he's the founder and director of CUH Arts. Chris Bell, next to him there, is Britten Sinfonia's Learning and Participation Lead. He's worked on projects in community settings, including prisons, schools, hospitals, and with people living with dementia. Krissy, Pride and Sian Ingham here are our 2 critical care specialist nurses, and they jointly facilitated this collaboration between critical care staff, CUH Arts and musicians, and Sian is also a harpist. And Bridget Carey here is a viola player in Britten Sinfonia, and like Sam, she's performed in the ICU as part of this project. She's also one of the most highly regarded performers of contemporary solo and chamber music, and in her own words, has played in pretty much all places you can imagine. So welcome everyone, thank you so much for being here. And before we chat to the panel, we're just going to watch a short snippet which shows the project in action so you can get an idea of what it was really like.
Oh, it was lovely, really lovely. So sort of exhilarating, really. Oh, I think music can take you into a different world.
The intensive care unit is stereotypically a very difficult place to be. It's very clinical, very sterile. Generally our patients are incredibly unwell, the sickest in the hospital. So it can be a very emotive time for the patient and their families. So having the musicians come in just to uplift their well-being and give them a chance to break up their day and potentially participate in creating something that is wildly different from anything else in their day-to-day activity whilst they're with us.
John on the film there, really powerful. He said, music takes you into a different world. Krissy, we just saw you on the film, so let's start with you. Was that the kind of reaction that you hoped for when you first thought of this project? Have the microphone.
Thank you. Hello, everyone. I think the reactions surpassed anything we could imagine when the musicians are with our patients and they came in. As I said in the film, a lot of the people that are there are very dehumanised. You're at a point in your life where something critical has happened to your body. Sometimes it's a trauma, sometimes it's a long-term illness, and you lose all control. And you have someone doing everything for you. So to have that moment where you feel a little bit more like yourself and bring back your own identity again, and just to feel like you're present and part of the room with everyone else, not just a patient in a bed, which is often the case, sadly. So, yeah, often when we saw these reactions from people where we had patients who they may have had, it's quite sad to hear, but they may have had a brain injury, for example, from a road traffic accident. And they're not doing a lot, but then to have musicians playing and for the first time they're moving their arms or opening their eyes, and they've never done that before. And we saw that the first time, and we really were like, oh, that's quite special. But to see it happen over and over and over again over the 4-day period, it was amazing. And it just goes to show what an intervention like that could do and what the potential of this sort of work could be. Yeah.
Sian, looking back at that film, what's the thing that comes into your head? What's your kind of number one memory of it? The thing the most powerful thing that moved you about it, the project?
I think, as Krissy was saying, really, it wasn't one particular thing. It was the consistency of powerful moments with patients, and it was the things like patients clapping when they hadn't been moving at all, and it's the first time, they'd actually woken up and started moving. It was the motivation afterwards. We noticed patients' moods were much increased, and they were wanting to do a lot more afterwards. So their rehab was, improved and made such a big difference to that. Lots of people got very emotional as well, but in a kind of happy way. It wasn't a, sad way. It was a connection. So they felt able to kind of let their emotions out. And I think, for me, it was the bringing everyone together. So the patients, the relatives, the staff, the physios, everyone together, and everyone was kind of level in that room at the same time. Whereas, often it's kind of, there's a divide really between staff and patients. And for me, the room was together, and that was really, really powerful.
Yeah. Let's ask the musicians the same question, actually, just to get a kind of feel of the impact of this. Bridget, what's your overriding memory, I suppose, when you look back at that film, or the thing that stays with you more than anything?
Yes, it was. I think it's because meeting people. I mean, as Krissy said, many of the patients were very, very unwell.
Yeah.
And yet we managed to make a connection with so many people. And yes, I think it was a surprise, because one of the really great things about it was how you prepared us for we had a good sense of what we were going into, but I think it was a surprise to make that connection.
Were you surprised at how willingly they physically engaged?
Yes.
Do you think? Yeah,
yes.
Yeah, which we saw John doing there.
Yes, and several people, even because I remember Sam saying, I'm going to bring a baton, and Sarah and I looked at each other. Yeah, how's that going to work? And that several people wanted to take the lead to move, and then we moved with them.
Yeah.
And yeah.
Yeah. Let's go same question to Sam. You can just pass the baton down. Sam, again, same to you. Looking back on that film, what's the thing that stays with you, the overriding memory of the impact of what you did? We'll get to lots more of that later, but the one thing perhaps that just stays in your mind.
I think for me it's, well, the answer that I have at the moment anyway is that it felt like all of the music that we made and all of the connections that we made and the meetings that we had felt very charged, and it felt like we musicians and everybody who was working on the team and also the patients and the families that we met were really, really present in those interactions. And that's something that in day-to-day life isn't always the case. You know, we have distractions and all of these things that prevent us from, actually it would be exhausting if we were like that all the time. It wouldn't work. But something about being in the hospital environment, obviously, all of the normal activities and distractions and clutter and schedules and responsibilities, they're just swept away. They're off. And then people are also confronted with mortality or with a health crisis, and so people are in a very, very vulnerable state already. And then people are receiving beautiful, dedicated care from the team here at the hospital. And just bringing music into that, I feel like it accents the connection that is already there. And so it felt like when we met people and the music that we made together, whether we were just playing for people or whether we were creating music together with people, it felt really, really present and connected.
Yeah. Thank you. Let's go back to the start before the project. A question for you, Akua. What did the project set out to achieve? What were your expectations at the start? Why did you do it, really?
Well, the overall aim, the overarching aim of CUH Arts is to humanise the hospital environment. And prior to the residency, we had begun to develop a relationship through music with the ICU, bringing musicians to that space as part of our CUH Sounds programme. So when the opportunity for the residency arrived, it was through discussions with Sian and Krissy, we identified this notion of wanting to enhance the ICU experience for patients. So Sian and Krissy may explain in more depth. They already spoke about the vulnerability that patients experience whilst they're unwell, but there's also what they take with them once they've left that environment as too. And by bringing music into that space, we have the opportunity to create a form of positive memory of that experience.
Yeah. Do you think it's got something to do with the fact that I suspect that classical musicians is a trusted sector? We know that museums, for example, are one of the most trusted sectors, and I suspect people think that about classical music as well. And you talk about humanising, not normalising. I think that's very important. But do you think it's bringing a trusted thing into such an intensive place that's key? There's something that everybody kind of said, oh yeah, that's going to be all right, classical music, isn't it?
Yeah, and I think it's more than that. I mean, the beauty of working with the Sinfonia and their wonderful musicians, these are highly skilled people who are at complete ease with their craft. And in doing so, when they enter the space, it becomes more than just the music, because they offer up an opportunity for conversation with the patients, and they can also respond to the patient's mood and interest with the music. So there's trust in the quality of the skills of the musicians that we've worked with, for sure.
Thank you. Yes, please.
I think there's also something around actually even more so than trust, just sometimes the juxtaposition of two sort of something you don't expect. And I think that's sort of where we started when we started working in the hospital was, you don't expect to see classical musicians roaming the public wards. And so I think that there is something sometimes about two really different things coming together that actually makes something really special, because there aren't as many overlaps in terms of our sort of shared knowledge.
Yeah. Thank you, Sian. I think Akua there just mentioned as well things like PTSD. Was that one of the objectives at the start, from your perspective, sort of coping with helping people manage that?
Yeah. So a lot of our role is follow up for patients that have been in intensive care and support for them while they're in intensive care, and for their relatives as well. So we're very aware of the impact of intensive care and what it can do, and critical illness on not just the body but the mind as well. And we see this much further down the line, 6 months, a year, up to 5 years, and forever down the line, and the impact it can have. So things like PTSD is something that's very common afterwards. Lots of patients will have delirium, intensive care delirium as well, so we know that that has a massive impact on them. Yeah. And just things like getting back to a normal quality of life after being critically unwell is a lot of patients really struggle, and their relatives do as well, so the impact is huge. So for us, this was a really interesting kind of experiment, really, to see whether that made any difference to their time in intensive care, and whether it can kind of cut through some of that trauma that they're experiencing, and things like just the alarms and the environment and the lack of control, lack of choices. It's absolutely huge, the just general kind of being weak and not able to concentrate and take things in. So it was all about the moment, really, and people being able to be there in that moment and have some joy in that moment in probably the most difficult time in their entire lives, as well as the relatives as well. So.
Yeah.
Oh, yeah.
Yeah.
And I was just going to say as well that because of all the medications that a lot of our patients receive, they often don't remember their time in intensive care. And when we meet them again further along in their journey, perhaps in a year or so, and they come back to our follow-up clinic to talk about their experiences, they may not remember what happened, but they remember the feelings. And actually, we're very interested to see when we start to see the patients come back to us in a year or so, or a few months, if they did participate in the programme, do they remember anything? Do they have any feelings? Can't wait to find out, really, to see if they remember and what that impact might be.
Thank you. And I think this could be a question for probably both Sam and Chris. You've got two very different cultures here. You've got the hospital culture, and then you're kind of cutting through this with something very creative. Was that something you gave a lot of thought to in advance, or are you quite used to that with your previous work?
I think certainly from my perspective, we're used to working in so many different environments, and what it really comes down to is the partnerships and the people. That as long as that's there and we've got that secure, in terms of just sharing that knowledge and feeling confident going into that environment, I think that's we're sort of quite used to that. But Sam.
Yeah, I mean, I agree. I think also from the classical music world is also not all creative as well, contrary to what people might think, and it's also bound by kind of problematic cultural inheritance, and so this kind of collaboration is hard for orchestras as well, and Britten Sinfonia do it very, very well.
I mean, everyone's been so positive about this project when I spoke to the individuals, but no project is without its challenges. So let's just talk about the kind of getting it off the ground bit. And again, it's back to Sian and Krissy there. That did you have any pushback initially when you said, we've got this great idea, shall we do it? Do you want to share some of that with us?
Yeah, we did. So when we knew that the project was going to happen, what part of mine and yours role was to try and onboard the rest of our team to actually get involved and want to do it. And the culture of our ward environment is so academic and medicalised and bound by routines and things like that, that it's quite hard for a lot of people to think outside the box. So when we first started organising meetings to go and visit the different parts within our workforce within critical care and explaining what we planned to do, we sort of were met with a sort of 50-50, weren't we? So there would be one side that were really excited and really up for trying something new. It would reveal that they were musicians in some way or had some sort of interest in the creative arts, and it brought a lot of stories up. And then you'd have the other half that just did not understand it. They were just like, why are we doing this? And they just grumbled along, and we just carried on anyway. And actually the result on the other side of it has been really interesting, hasn't it? So the people that were really excited have only got more excited. And then those who were sceptical or didn't know what to expect, or perhaps didn't quite understand the project, really felt the value, not only by observing, but something that's been quite incredible is the impact it's had on our workforce as well. So we we actually collected a bit of data between us, didn't we, where we collected feedback from staff members as well as the relatives on their well-being, and actually their productivity improved throughout the day. They felt more calm, they felt more in tune and able to work in a better, safer, like more focused way. Perhaps if they come to work and they were not feeling so great, they were boosted and able to work really well. And we did some staff workshops as well, and actually that really brought people together in a way that was quite unexpected. And even though the project was back in April and some time has passed, people are starting already to ask when it's going to happen again. Not only from the aspect of the patients, but because it made the team feel good and improved their work and how they were able to deliver the care that we give. So yeah, it was really interesting.
You mentioned, that some of the people who kind of had the initial buy were actually musicians, which I'm not surprised they kind of bought into it more readily. Sian, do you think it helped that you are a musician? Admittedly, of quite a large, cumbersome instrument that you play. You must have been able to imagine it in there and thought, this is going to work, thinking as a harpist. Was that a key part to it?
Yeah, and I think having had the musicians monthly for a few months before that, we'd sort of knew that it would work and they would fit into the space and things. And we'd had the harp, the cello. And so that kind of helped as well, sort of preparing for it. And yeah, I think, knowing, obviously harp is huge and having all the instruments and the cases and things, which we sort of managed to find room for. I think we realised that actually it kind of fitted in, people sort of fitted in around it. So we had a lot of people coming in from different bays. We had patients that hadn't come out of their side room for, I think one patient, it was about 4 or 5 weeks. And he actually walked out because he was so interested in the music. So we had a lot of people coming into the space rather than the space taking over, if you know what I mean. Yeah. So we thought that might be a challenge, but actually it wasn't. And I think we were quite lucky at the time. Sometimes with intensive care, emergencies happen. You never quite know what's going to happen, which we kind of prepped everyone for anyway. But actually we were quite lucky in those kind of 4 days that it was generally quite calm at that point as well. Yeah. So, and we even had relatives get involved that were musicians as well. So we had one of the patient's sons playing guitar, and he got involved. We had people singing. So it just brought that sort of connection really with everyone. But yeah, I think the main challenge was staff really to get them coming round. Okay.
One of the main things on the actual days of when the project was taking place was you and I were very much almost like a bridge, we felt, didn't we, between the musicians and the staff, because we had to almost read the room constantly from a clinical point of view to manage, to almost preempt whether our patients were able to tolerate what was happening, if it was appropriate at the time, but also look out for the musicians to make sure that they felt okay in order to be able to perform what they would like to do. And I think that was actually really important for the project, to have that sort of person that sort of crosses over both.
Yeah, I think you sort of took on the role of producers as well to an extent, didn't you?
Didn't know that we were doing that.
Sounds like that, but just keeping one eye on the detail, one eye on the bigger picture. You have to have eyes everywhere, don't you?
So even in situations where it may, to most people, you may think it's inappropriate. Like we did have some patients that were coming to the end of their life, and actually, rather than just say, let's just give them some space and stay away, we still offered to play music, and they accepted every time. Yeah. And actually, it's left them with amazing memories of those last moments.
Yeah.
So,
yeah. Thank you. I think let's ask the same questions to the musicians and the producers about the sort of initial challenges. Did you face any pushback from the musicians, Chris, or are they really up for it? Or
I think the players. We've been here for three years now, and I think I've got to the point that the players just about trust me with most things. But certainly, speaking with colleagues, speaking with industry colleagues, there was definitely a sort of sense of pushback of like, you're doing what? Like that's, and when I sort of told other members of my senior leadership, they said, really? Are you sure about that? How's that going to work? And I think so much of that has been just down to that sort of just thinking about those sort of links, really. So Sian and Krissy were that link between the musicians and the patients, and then sort of myself and Akua are sort of that link between, I guess, the sort of that level of detail from an organisational perspective and the musicians, and sort of because that link works. I think that's sort of why it didn't feel like a challenge in the end, and sort of everyone felt on board in that sense. I think another challenge, one of the challenges again was around space. I was thinking, how are we going to fit in there? And often where we've been coming into the hospital for 2.5 years or so now, that you do have to find little nooks and crannies to try and play, and just to be quite flexible in that sense. But I was amazed at how sort of nimbly you could sort of move things around, and that's sort of partly just to the setup of the different wards. But it meant that I don't, and I was speaking with Sarah, one of our musicians, who was saying that you didn't feel in the way, actually, because you were sort of constantly having things moved around you and that sort of stuff.
Yeah.
So.
And Sam, as a workshop leader, what were your biggest challenges with this project?
Well, I think the main thing that I was concerned about, actually, I felt confident about the workshops, because I trusted the team that we were working with, and I trusted the relationships and the partnerships. I was anxious about the culmination and how we were going to present and share the work that we'd done, because there was a sort of culmination day plan as part of the project. But that we sorted that out in time. But I think this brings me back to what I was going to say earlier on, which I forgot. But so much of this work is about, Chris, you talk about about the links, and I think the work is relationship. It's all about relationships. It's relationship-founded work, and playing music in an ensemble is based on trust. You have got to, and there's also that implicit trust between performers and an audience as well, and. The reason I felt confident about this project was that from the very first meetings that we had, and there were lots of meetings, that it was really, really clear that the work that we were going to do together, even though we didn't know what it was going to look like at first, and that slowly took shape, but it became really, really clear that we had a foundation of shared values. And that regardless of our different cultures and our different skills and competencies, that we were all at the bottom, we were all working for the same reasons, that we were working from a place of respect and of inclusion and of care and of flexibility and of kind of wanting to offer something that was a really good quality, and that actually that's what I've observed is that the best work happens when, regardless of who's delivering the work and what it looks like, the values that underpinning it are shared, and that was so clearly the case on this project from the beginning and throughout. So, that.
We were talking about challenges, but everyone just keeps telling us how they overcome them, which is brilliant, as they did. Bridget, let's talk about the practicalities as a musician of coming into a space like that. We're talking, performance space, and is there room to bow and repertoire and music stands?
Yes.
Just talk us through your experience as a performer in the unit.
Because coming in and bringing my instrument, which is 400 years old, and all the rest of it, you have to look after it. And then Sam had a cello, so at least mine tucks under the chin, and we had the flute. But the cello, you sort of need a chair to play a cello. But so we knew we needed to be flexible. So we had to adapt to the various spaces. So sometimes there wasn't room for us all to, or appropriate for us all to cluster around, certainly not in the first instance. And then, yes, the thing about music.
So you must have had to be very flexible with, if suddenly only one person can fit in there, you might not be able to play what you planned on playing. So you have to jump to something else.
Yes, and planning on playing, there's another thing. We talked about repertoire, and so we had a little bit of repertoire. We loaded that onto our iPads, which is there. So it's technology's got some upsides, because then at least you don't have music stands and flapping bits of music and all the rest of it. And you don't necessarily have to have an iPad each. You can play off a score, so that brings down the clutter a little bit in the room. But there was also the need to be spontaneous musically, and to be able to offer something musically that wasn't necessarily say, oh, I'm going to play this tune. That's what we all have different practices. We play in Britten Sinfonia, Sarah and I play in Britten Sinfonia together, but we also have different musical practices. We're freelance musicians. So we have a lot of different experiences, but that, as Sam says, music making, it's trust. It's like when you go to the circus and you watch a trapeze. You have to trust that somebody's going to be there to catch you. And that's the case when you're sitting down and playing a score, and also, even more so, when you take a leap and you say, right, well, I'm going to play. I'm going to look at this person opposite me in the bed who wants me to make music, and I'm going to respond to that, and then my colleagues are going to support what I do musically. And so that element of trust is huge. But at that point, at least you can chuck away the music, and because it's to do with communication. As I'm not very good at public speaking. That's not my thing, but I'm quite good at communicating if I've got the fiddle in my hand. I find it more comfortable in a way, and that's my practice. I think that's one of the things about the staff sessions, actually. It was so nice for them to see that trust. And also that we had staff sessions, we brought classroom percussion instruments, and invited people to choose things. But also that realisation that, as far as we're concerned, as musicians, their contribution on the triangle or the little wooden frog was just as valid as the E flat that Sam played. That's just as good as a starting point for a musical conversation, and that was a helpful thing.
Yeah, sorry, if I could just say about the staff sessions as well. I think that was a challenge as well, is walking into a big group of people, of staff, and them seeing all these instruments and thinking, oh God, do I have to play something? It's one person said, it's like being back at school and everyone's watching me, and the kind of awkwardness of it. But actually, once it started and people did, and a few people were, no, it's not for me, I'm not going to do it. But by the end, most people were all involved. And again, it just brought that kind of, joy, and everyone was in it together sort of thing. And then afterwards, they were asking for more. So, I think that was another challenge that was also overcome as well.
I think one of the perhaps the reasons why it feels like we've sort of overcome quite a lot of these challenges is because we did all feel a real sort of when I say nervousness, it's not that we weren't confident we could do it, but it's, I think, a sort of sense of responsibility to the patients and their experience. So I think it's really important that, I think we were all quite nervous about that. So that's why we were like trying to think through every single little detail and try and adapt, because there is that responsibility that we all share, and that's what was, as Sam was saying, what was really special is that there was this sort of shared value of caring for the patients is absolutely the top priority. It's not, it's not about music, it's not about whatever. It's going from there and working upwards.
Thank you. And the question, the theme of trust keeps coming up quite a lot. Akua, you must have had absolute confidence in the team of people that you've got here to deliver this and to pull this off. Is that right?
Oh, absolutely. As Natalie said at the top of the event, we've been partnering with Britten Sinfonia for some time. Obviously, CUH Arts we're arts professionals, we're not clinicians. So, you know, there was immense trust, if not gratitude, actually, for the ways in which Sian and Krissy embraced this idea and brought us into their manor, so to speak. You know, at the beginning of the project, they gave us, we had a knowledge exchange day where we learnt from Krissy and Sian the experience of patients within ICU, some of the aspects of the environment, and what we might encounter whilst we were there. Equally, the Sinfonia shared with the clinicians in ICU an insight into the kind of music activity that would be delivered. And what it served to do, actually, this kind of intense way of working on the environment, it served to kind of build the staff's awareness of this work and the potential of it. I think that was something that Krissy and Sian both touched on. But as we were walking around the wards during the week, I was having conversations with members of staff that I hadn't previously spoken with, who had seen the activity, and that they'd stopped. People were actually stopping and taking this in, and then asking questions about the potential of this within their environment. It was a great way to, as you say, build trust in the opportunity and the experience, actually not just within the ICU, but for potentially other environments within the hospital as well. And in fact, we are looking at another residency later this year.
We're moving effortlessly and beautifully on to kind of impact and, you know, things that you anticipated and perhaps some surprises as well. So I think that's a good one to go around with the panel with, and sort of just tell us a little bit. I mean, at the beginning you shared some stories of things you remembered, but let's kind of unpack the real impact of this a little bit on perhaps behaviours, things you might immediately take forwards, ways that it changed your thinking about things before we really go into any evaluation. Just sort of your general feelings on the impact. Should we start with Krissy and Sian? Thank you.
Yeah, I mean, the impacts for me was, I knew it would have a big impact, but I had no idea how much of an impact. And for me, just personally bringing music and my career into one sort of space was a real, dream in a way, and amazing to see how it affected, you know, everybody. I think
you mentioned staff morale before. And family morale, patient, you know, was that quite long-lasting for all of them, do you think?
Absolutely, yeah. I think, I mean, for me, seeing patients, I think the emotions, where patients haven't been able to kind of sort of, you know, be emotional, and it was a kind of route for them to listen to the music and be able to show and share some emotions, and share the emotions with their family members as well. And little things like certain songs would spark memories, you know, things from the past. The patients will be requesting songs, and it was just sort of bringing them back to their own identity and their sort of human side of who they were. And that was huge, and we just kept seeing it over and over again. And yes, people getting involved and being engaged, whereas, you know, we've known that certain people, they weren't able, they haven't been doing anything, they've been on sedation for a long time, they've not been kind of waking up in intensive care and opening their eyes, clapping, smiling, all the expressions was something that sort of seeing it was just so powerful.
Krissy, I think you mentioned earlier a family member bringing an instrument in, and you're thinking, well, this worked really well. Is that something you would just immediately encourage now? Is that a kind of instant change of behaviour where you think, well, that works, even without a programme like this?
So we already encourage family members to bring in items that would bring comfort to the patient. So it could be photos, paintings, pictures from their children or something like that, or a favourite blanket. But I can't say that we've ever had anyone bring their own instrument in. So I don't think I was on that particular occasion, but there was someone who brought a guitar in and was playing for their mum, I think. And then there was also an experience we had on one of the one of the wards, the neuro wards, where there were 3 patients in a bay. We actually managed to get all 3 of them nearly playing together at the same time, and all the nurses and their relatives singing in like the harmony that we did. And it was so unusual, like that would never, it's so unusual. So what's stopping us from doing that again? Like if someone's feeling confident and wants, you have a few patients together that might want to do something like that. And I think there's a lot of people just think, oh, intensive care, they're really unwell, let's just hold back. But actually it just brings people together. I just wanted to say another thing on the impact as well with staff. When we've tried to do projects in critical care, it doesn't always reach all of the staff, because across our 4 critical care units we have over 500 members of staff, 56 beds, so it's a huge workforce. I think this one has actually managed to affect nearly everyone, which is a huge number of people. Yeah.
Thank you. Sam, would you like to say something about the impact on the musicians? Did it change things for you, or anything you took away?
I can speak for myself, but I'll hand over to Bridget. So for me, I think there's 2 things I would want to share, really. One is that, the work is intense work as a musician in this setting. It's probably no more intense than it is for clinicians and nurses and medics, but it's not something that we do every day. And even though we're not music therapists, we are clearly working in a therapeutic setting, and lots of the methods that we're using, particularly when we're using improvisation, are very, very similar methods to what music therapists would use. So, and then my belief is that in order to do this work successfully as a musician, you've got to turn up, and you've got to be ready to connect with people authentically and be open to meeting people where they're at. And often people are quite unwell, and so you end up taking on taking on kind of psychic content, and so for that reason, it's really, really important to have a kind of debrief framework and support framework for musicians at the end of a session, at the end of a project. And even though I knew that entering this project, it still blindsided me a little bit. So I don't know whether it was because as leading this project from a musical point of view, I was sort of doing quite different things, from bedside sessions to then leading a training session with staff. It was required quite a lot of kind of role shifting for me. So it really, really took it out of me. And it took me a little while to kind of understand that I needed to seek that support for myself after sessions, as well as trying to offer it to the Britten Sinfonia musicians. So that's one thing. And the other thing is just really the other kind of impact for me is that I was just bowled over by Bridget and Sarah and their willingness to embrace the methods that we were using on this project, which were, as we have sort of touched on, around improvisation and creating new material, which is that's central to the way that I work in different settings. But for lots of classical musicians, it's not necessarily a core part of practice. Like it would more typically be turning up, having a score, reading off a score, playing a sport, like all of those. So inviting musicians to embrace a completely different way of working with much more risk involved. Was inviting them to take a big leap in the dark, and I just was it was very, very clear that they were, from the beginning of the project, that they were fully up for embracing that. And so that was something that, like, thinking of, for me in future when I work with orchestral musicians and classical musicians, is to not to sort of be timid about making that invitation, because sometimes I don't want people to feel too uncomfortable, but it's clear that with the right musicians and with the right kind of ethos, people can really, really embrace that way of working, and with some really beautiful outcomes.
Yeah, so thank you. Chris, Britten Sinfonia's strapline. For 30 years, Britten Sinfonia has been pushing the boundaries of what a chamber orchestra can do. This seems to absolutely fit with that. Would you agree? Does it change? Is that the orchestra's role in 21st century?
Yeah, I think that the role of an orchestra has changed really significantly over the last, especially over the last 100 years, but even more so in the last 30. I think that orchestras, we've the sort of systemic things that have been built in around hierarchies and sort of etiquette, concert etiquette, and all that sort of stuff. And actually now I see one of the sort of words that I use quite a lot is about the sort of social impact of that organisation. We've got to remember an orchestra is a charity, so what fundamentally, yes, absolutely to improve the access of music for people in the east of England, but that can't just be a sort of superficial, yes, we're improving access by putting on concerts. It's about going deeper than that and finding those connections. I think I always get quite a sort of unique perspective on the project in the sense that I tend to be involved quite early on in the design of it and speaking and sort of hopefully asking the right questions in the run-up to it. And then I've got my colleague Faye who supports me with the delivery because we have quite a wide, broad programme. But one of the things that I think really struck me at the end, which felt, this is a Britten Sinfonia project, was at the end, coming into the debrief at the end of the culmination day, and sort of just sort of sitting back and listening and sort of hearing the interactions and just thinking, this is collaboration, because absolutely everyone had been. You can just sort of tell, and hopefully you've seen that everyone's been affected by it in such different and personal ways. But that really is as a result of collaboration and sort of working in a slightly more innovative way.
And Bridget, did it have an impact on your practice individually, perhaps, as a musician? Has it changed anything for you?
Yes, I think every project that I do contributes to my practice in a way. My practice is quite wide. It's generally chamber music, so these days, although I've done all sorts of things in my past, the Britten Sinfonia, when it's a chamber orchestra, is about the biggest group of people I turn out with regularly these days. I'll often be working with 3 or 4 other people. But I think having a varied practice means that everything feeds back. I work a lot in new music. I work a lot with composers. So I'm making new work a lot of the time. I'm making connections and seeing different ways to make musical connections is a positive feedback loop for me. That's going to help me the next time I sit down and play, Ravel's string quartet. It's going to help me the next time I sit down and work with a young composer. Just having found a new neural loop, as it were, for making musical communication. So it is a positive thing.
Yeah.
Do you agree with that?
Yeah. We've heard so many positive stories and very powerful and impactful stories for you personally and what the project achieved. Sian and Krissy, how important and how difficult is it to evaluate this project, though? Perhaps to what extent do you need to? Perhaps you'd like to say something about that and where your thoughts currently are.
Yeah, it's very tricky to evaluate it in data or anything like that, which one day it would be really good to collect data, but unfortunately it has to go through ethics and things like that. One interesting thing we were seeing a lot of is on the monitors, we were just for interest looking at the different measurements, and actually a lot of the time with the music playing, the heart rate was coming down, the blood pressure was coming down. So there was definite kind of data that we saw firsthand that was having an impact with the patients, but mainly it was just the kind of seeing it and seeing the kind of expressions and the kind of feel in the room changed as well. And it just something, the moment just was there and it was quite special to see.
We did do some surveys where we asked relatives and staff members who were involved in each session it was very basic, but just to score their well-being, anxiety levels and stress levels before the session and after. And it was overwhelmingly positive, wasn't it? And they also wrote some amazing, wonderful feedback. There was nothing negative, without nothing at all, was there? but quite touching comments, not just, oh, that was nice. Like, people made an effort to say that it really had improved their well-being, their anxiety levels, seeing their mum move for the first time, like, was enough to boost them for the next few weeks. So we have that sort of data that we've got that we can measure at them. It's very basic data, but we're going to be taking it to a conference, a nursing conference, a national one in October. So we're sharing that more, I guess, from the clinical sort of side, because it's such an unusual concept as well. So that's quite nice. But in the future, yes, it would be lovely to do a proper research study.
Yeah. And Akua, as producer, you know, and a strategist as well, how important is it for you to collect data from something like this?
CUH Arts quite recently adopted a new approach to its evaluation, in that we wanted to have open conversations with patients and participants, and make sure that we kind of record quite full and accurate kind of responses to the activity. And so we applied that approach to conversations with the musicians and with Krissy and Sian. And in terms of what that does for people's awareness of the value of this work and the impact of that work, it's huge. It's really important. And just to kind of add, the visibility, being able to deliver 4 days of music in a row, it has a huge impact. Not only are we present in the hospital consistently over those times, but we get to see several patients repeatedly as well, and we get to see how they are impacted by the presence of that. And in most cases, in nearly all of them, it was for the better. I recall a female patient at the beginning of the project who was actually fearful of the musicians entering into the room because she thought that their presence meant that she was dying. But by the end of the residency, she was requesting their presence and even requesting particular pieces of music to be played. It's so important that we document this work carefully, which we have also done through an exhibition as well that's currently on.
Nice plug. Do go and see it, everybody. Stay with the microphone for a minute, Akua. I'm going to ask one more question, and then we'll open it up to the floor. So if you've got questions, now is the time to be thinking about how you're going to phrase them in your heads for the next bit. Akua, we've heard so many positive things, and we've heard, I think, models of good practice in terms of planning and briefing and communication and shared values. All these things make it a model of success. And I think certainly probably the question a lot of people is going to be thinking is what next? Is there a what next? What are your ambitions for this work?
There certainly is a what next, in that in the autumn we are planning to deliver a further residency. So the residency that we experienced with the ICU team, that was actually the second residency that Britten Sinfonia had delivered at Addenbrooke's. There was one prior to that, and so we look forward to our third, and hopefully working with oncology in that instance. And then we also continue to deliver CUH Sounds, which is our ongoing music programme, through which Britten Sinfonia are the key partner. So music has even today returned to the ICU, and also on Monday through that relationship that we have with Britten Sinfonia. Hopefully this example enables more awareness and information, so that there is a reduced hesitancy for bringing in the work, but also that we increase demand for this as well. Of course, we have to increase capacity too, but, we'll hit that bridge when we come to it.
Yeah, Sian and Krissy, no one's talking about just rolling this out across every ward in every hospital overnight, are they? Are you a little bit cautious? Do you need time to reflect, disseminate? What's your thoughts on the next steps? Or are you eager to get going with it?
I don't have any thoughts on waiting. If it could be a regular thing, it would be incredible. Yeah, I feel like everyone deserves what our patients have experienced and our staff members. So, yeah.
But the uniqueness of the team is key, getting the right people together, would you say?
Yeah, and I think I guess from a clinical point of view, if there was other people on other parts of the hospital or in other hospitals, that would be my key thing, would be that communication and teamwork and that openness to the project, because the relationship is the most important to the success, I think. Yeah.
I think now we've sort of integrated music as part of intensive care in a way. That's already helped for future, because I think even the cleaners, the nurses, everyone got involved. So now it's just been highlighted that it's something that we can do. So I think moving forwards, it's a really positive thing that it's already sort of been implemented.
Wonderful. Oh, sorry.
I was going to say that I haven't worked in another hospital setting, but I would say that the setup that we have here, the fact that you've got a dedicated arts team, such a big and experienced dedicated arts team, and also, I mean, your introduction to your particular environment was absolutely invaluable. But the support we had as a bunch of musicians to come in, that made everything possible.
That's a good positive note. Shall we take some questions from the floor?
Well, thank you very much indeed. I think it's amazing, and you based it on excellent relationships and really careful planning, which is, in this sort of thing, you can't do without. So great admiration. And your bridge medics were, without your bridge medics, it wouldn't have worked. So, we should applaud them, really. I mean, just, just a couple of quick things. One, I do feel that supervision and debrief should be built in and funded from the very beginning, because I think you said what it takes, I mean, in a sense, you need it too every day, I think, the medics on the wards. But musicians coming in, they're putting lots of emotional themselves in, and they're not pros like you with the medical side. And I think that when they go into schools even, they need debriefing, when they go into prisons, and all more so when they go into hospitals. So I think that's something that ought to be in the interesting and funded. So just something. Also, I think we've missed a lot on the research point of view, because everything is coming out. I realise you've got to go through ethics and all that, but not Essex, sorry, ethics. But I think that's something that needs to be in there. I think it's been superb, and I think Bridget and colleagues, I've seen a bit of your work, not in ICU, but in the other places, and having your choice of the correct musician to come in, because not everybody, some people want to do master classes, not everybody will. So again, the Britten Sinfonia has been really careful about that, so I think that's been great. I think a couple of other things. I just wondered which instruments are more suitable, because somebody with a trombone said, would I do? And I said, it depends how quietly you can play, and etc. So that was one question. And also a difficult one. We're doing quite a lot of work at Addenbrooke with palliative care now, because, and I just feel that some people have said to me, I wish I'd had somebody with a violin when my mother was, whatever. I think that's something that perhaps there should be more research and work on. And Anglia-Ruskin University, as you know, have very strong music therapy. I think you've got a music therapist on the team, and perhaps they might be able to help with all this sort of stuff and get that. Where is she? There you go. Is that right? Yeah. So I think there should be, it's just my view, that there should be a good link up, because we've already got all the stuff there, but really fascinating. And the medics, I'm full of, and what did you play? I missed that at the beginning. Well, there you are, you see. The harp should be on the ward all the time. Thank you very much. Well done, everybody. I think it's terrific. Thank you.
Right.
Thank you.
Lots of questions there. Shall we tackle the one about the instruments first? Was that the first one, I think, about what instruments are appropriate and what aren't?
Yeah, I think sort of my two key takeaways, I think, with working with this orchestra is don't worry so much about instruments. I think when I remember actually our first session where we brought Imogen, our principal trumpet player, into the ward, and I spoke to Akua, and Akua went, "Sure." How quiet can they be? And actually, it was one of the strongest sessions I think we've delivered. But I think that, and also, bringing. I think one of the things it's the same in schools as it is in hospital settings. Just bringing such a variety of music and bringing challenging, complicated music that it doesn't have to be simple. It doesn't have to be all the well-known stuff. And that's where that sort of magic happens. So obviously there are practical considerations. There's things we've done. I think when I first started, we did do a session with a keyboard. That was quite cumbersome, I'd say. But equally, we found harp. I mean, harp does have this sort of transformational, quality to it. That I think so many times where we are, that works really well. But I think when we were considering the makeup of this group, we knew that we really wanted to work with Sam on this, who's a cellist, and so we were starting to think, okay, what sort of instruments will go with that, and also build on the practice for the musicians. Sarah and Bridget have both been visiting the hospital regularly over the last 18 months prior to that, and we sort of invested in training and trying to ensure that they feel confident and comfortable in doing that. So yeah, that came into it.
Thank you. Sorry, what was the second question?
I think there were just a couple of things about palliative care was one, and also CCRH. You're going oncology. I think you're going on to CCRH. The new cancer hospital will have single rooms. And one of the things we're battling with there is how do you get people together? Some people for infection control, I don't know, infection control on the viola, I'm not sure about that, but how do you do that? I just wondered if your experience could translate to the people working on that.
So, as I mentioned before, with palliative care, so we did have experiences of that within our project. One particular person who was very awake and participatory and enjoyed it very much. And then we played for him towards the end of his life as well. And since then, his mum has the recording and the podcasts. And she's so very grateful that she has those, because not many people get those very last moments, or even those last days. People are afraid to take a photograph, or they're things like that. So if you can create something where you feel connected together, that you're not just that person at the end of their life in their bed waiting, I think it's really important. I think it's a really important thing to be able to offer. With regards to infection control, that was an interesting one. So obviously we're going for different wards, obviously washing our hands, but I think, is it your cello? I don't know, like hundreds of year-old instruments that you don't want to be wiping down and all of these things. So it's been very careful about how we approach that. And we did have rooms we couldn't go into, but we could let them know that this was happening and they can still listen from the outside. It was still making that impact. Depending on the design of the new hospital, I know at Papworth in their intensive care, they have individual rooms that have glass doors that can be partitioned and opened depending on their infection status, so they can still observe and see. So it depends on, I guess, how it looks, but it's certainly workable, and I think it's an amazing thing to be able to offer.
Can I chip in on the new hospital front?
Yeah.
Because we as an arts team are working really, really closely on the design of the new hospital. So we, as a trust, are building a cancer research hospital, and we are building a new children's hospital, both big, important regional hospitals for our area. And we know that our arts programme can do so much in those care environments, but we are working now to develop our practice. So everything that's happening here will feed through to how we as a team operate, and it's opening our eyes to new ways of working. So right now, even though those hospitals won't be opening for some years, they will open and they will have arts happening every day in them. It's really, really important that we use this time now, between now and then, to really grow how we work. So things like single rooms, really not very common in our current hospital, but will be the standard. So we are really advocating not just for creative activities within that setup, but also where are there communal spaces in our hospitals. We are working hard to secure spaces. I'm looking at my colleague Ellen at the back. We have a creative hub area in the design of the new children's hospital where we will be making sure we have creative activities every day for people. So I think, yeah, this is really, really relevant to the future of our programme and the future of healthcare at CUH.
Thank you. We have a question up there. Natalie, the gentleman in the white checked shirt.
Yes, it's absolutely fascinating. And I was just going to say, ask Krissy and Sian particularly. You said right at the start that patients who hadn't been moving their arms started to clap. And I was wondering, did the improvement, was the improvement sustained after the residency ceased? And if that's the case, what does that tell you about the importance of music in something as medically complex as ICU and other care? I mean, is it something that should be standard?
Yeah, it's hard to know exactly whether because we weren't seeing them every day after that, but definitely that day, or we heard from the other nurses and some of the doctors as well, that amazingly they just started to improve and their mood improved, and it just showed if their mood improved, their motivation and their movements and everything improved. So yeah, it's hard to sort of collect the data and quantify it, but it definitely, we noticed, and not just one patient, it seems to with a lot of patients as well. In intensive care, we measure patients' conscious levels. It's something we do every hour. It's part of our kind of measurements that we do of patients, and we did find that their conscious levels after the music sessions was slightly higher, and things like they were opening their eyes more, they were responding more. So yeah, I think it would be amazing to bring it in as part of therapy, and as Annie knows, music therapy is so important. So yeah.
I'm whizzing round.
Thank you. That was fabulous. I run a charity as well that also works with the intensive care unit here, and we support a partnership with Uganda. And music in Uganda in the hospitals is so much more present than here. So the nurses and all the staff gather every morning and sing together. And I know that there's already been, and one of you mentioned music with dementia. I know that somebody brought music from their experience in Uganda and set up a charity in the UK using music more effectively. So I guess rather than, do you think that perhaps there's learning there? And particularly what you were talking about, reaching all 500 plus critical care staff, it's extraordinary. Is there room for a conversation with Lisa Enoch, who you know very well, who leads that programme, about how can we learn it? CUH Arts is fantastic, and we've had this conversation, haven't we, about stuff that we can learn from other healthcare systems, where music perhaps hasn't been pushed out so much of the clinical environment, and people feel more comfortable, I guess, still bringing it to work. So I don't know if it's really a question, more just an encouragement, I think.
Who would like to comment on that?
Absolutely. I think there's so much learning from it. And I think it is about things like relatives bringing in their own instruments, playing with them. And it's not just the music and them listening, it's the connection and the engagement. And I think, it should be seen as more part of well-being, really, rather than, as we say, bring in photos, play the radio, but actually live music, why not? Why not bring in a guitar or something, anything really, and get them involved as well.
I was going to say as well that I haven't been to the Uganda trip, but I work with that education team that have, and I've seen the videos of the nurses standing up, singing and clapping every day, and it's moving even watching it from a video, let alone live. I think culturally we're not quite, we're probably a bit stiff in that respect, but I guess it just takes someone to have a bit of courage and give it a go. From a practice education point of view, maybe it starts there. Like in our educations, as we're training our nurses and our new critical care nurses, why not have a sing-song? It breaks the ice. It makes it memorable. They may probably remember more of the educational experience just because of that. There used to be in our ICU, I don't know if you know this, but on my very, very first day working in intensive care, where I was literally getting inducted, it was just before Christmas, and one of the consultants said, "Oh, you're new, do you sing?" And I was like, "I don't mind singing." She goes, "Come on, we're doing Christmas carols around the bedside." And she gathered a couple of nurses who liked singing. Someone brought a music book, and there I was following along, singing Christmas carols to the patients. And that was done within our unit. It didn't rely on anyone outside. And just reinstating little things like that can make such a difference, I think. Mm.
Yeah, and I think it was just oh, sorry.
As you're saying that, it makes me think about if we could go back to ancient Greece, physicians were trained as musicians in addition to being trained as physicians. So music historically has been a tool for healing. I think the piece that I wanted to come back to, and I kind of hear this thread in everything that everybody's sharing, but I've often felt in my own work in ICUs as a music therapist that the more technologically advanced it gets, the more humanistic we need to be in that care. Because we aren't just healing bodies, we're healing people, we're helping people heal. And in order to do that, we have to connect with our humanity, not only as healers of whatever form we are, but the person that is undergoing that healing. I'm wondering how you saw that humanity emerge, not only within yourselves in this process, but also from patients' families in their spot, in their place in this process. How did you feel it, hear it, see it emerging in that way across those days? That's a big question, I know.
So there are some lovely photos that were taken as part of this residency, and my favourite one is from the culmination day, and it's Chris, who is the cellist from the Britten Sinfonia, playing on one of the wards, and he's tiny in the middle of the frame. There's this tiny golden brown cello, and he's surrounded by a big kind of margin of pale blue walls and floors and costumes and technology, machines. And I think it's such a wonderful metaphor for the kind of humanity of music at the heart of the ICU. And I think that's one of the reasons why music is so powerful, full stop, and in particular here, is because it operates on a metaphorical level, because we all have our own way of relating to it, and which is deeply personal, and yet it sort of is found in the space between us. So I don't know if that necessarily answers your question, because the question was about how we witness the humanity emerging. I don't suppose I saw it like that. I think it's just I think I just felt that it was always there. It's just always there, and all you have to do is kind of look for it. And it's funny, like ICU is such a paradoxical environment because it is so technological and as you have said, patients are so institutionalized and so disempowered by virtue of the fact that of the situation that they're in, and because of the way that the hospital runs. And yet at the same time there is already such intense humanity present in there. It's like latent. So I think that taking music in just reveals it magically anyway, somehow, because it's just there, it's already there, but it's like kind of waving a magic wand, and all of a sudden you can see something that was already there anyway.
Okay, thank you very much. It's been really interesting to listen. I'd really like to find out a little bit more about the kind of programme of music that you planned and how you made that feel kind of culturally or socially relevant to the people listening. Like, where did you choose from particular periods of time, particular places, or what was there a theme? How did you sort of plan that?
I can talk about that, or I could hand over to you, Bridget.
We came with a bit of repertoire. We all contributed some repertoire. Repertoire, because we've been coming into the hospital in various different settings in the hospital, and repertoire is something, at the end of each project, we go, oh yes, we must talk about repertoire, because for starters, we coming in groups of maybe 2 from the orchestra, so 2 string players or 2 woodwind players, going somewhere. We've got to have something up our sleeve to play, and we're building up some repertoire. We're often asked for music, and now that's really taking a classically trained musician out of their comfort zone. You say, could you play? Or somebody did say, we were on ICU and there was a young man who was a musician who wasn't conscious at the time. His family were there, and his sister said, can you play some Bob Marley? And Sam could. Sam could play on his cello a bit of a riff, and he could sing, and then Sarah and I could join in at that point. We could jam up to that point. But if somebody says, and I have been asked this, not on ICU, can you play the Lark Ascending? What, on the viola right now, on my own? No, not really. We came with some suggestions. We had some Baroque, some classical favourites, lots of folky stuff, some light music stuff. That's where I struggle a little bit, But we had, everybody contributed something. But also, we were also coming prepared to actually make music with people, even though they weren't necessarily prepared in advance that they were going to participate in music making or had any idea that they could do that. So, and that's a thing that comes, from another place. Sam?
Can I just ask you a quick question about that, actually, Bridget? Would you say that you have to musicians are naturally perfectionists, we have to be. Would you say that you have to almost change your criteria for success in an environment like that? Because you're not going to play it perfectly, but actually a successful project in that environment isn't looking for a perfect performance. Is that something that has to shift within you as a classical musician?
Yes. Sarah's saying yes. Yeah. I mean, so I spent a lot of my career playing really, really complex new music by boffin-like composers, one of whom's terribly, terribly famous, who said, oh, well, actually the degree of success in my music is actually the audible criteria of meaningful inexactitude. And you think, oh, yeah, okay, so I've got it's given me my... I've held on to that for the whole of my career. I tried to get it right. I tried to do the right thing. And obviously, my musical practice is the sum of the musics that I have studied and the people that I've... But, as I say, it's a neural network. Every person that I work with brings something new, and it leaves something there with me to give back. Do you agree with that?
Yeah, I think it's yes and no, because I think that what Bridget and Sarah one of the things that they bring and that orchestral musicians bring to work like this, or opera singers, or when you're working with really, really talented, experienced, highly trained professional musicians, the combination of technical virtuosity and musicality bring a quality to the music making which is essential to the connection and the engagement that happens in work like this. So, like the criteria of successful classical high quality performance are important, but they're not the only thing that's important. And I think that's one of the things that's really tricky and complex about this is sometimes that might not be the most important thing. So, for example, if you go into a ward and somebody requests a song that you don't know very well, you might not be able to play it to the standard that you were hoped to if you were in Abbey Road with a symphony orchestra. But maybe that person just wants to hear that tune played on a flute. And success is for you to play that on request, and it might be a little bit gnarly, but you're present and you're there in the room and you're a human being responding to something that they've requested. So, yes and no.
I think there's also, when we first started coming into Addenbrooke's, so many players were saying to me, how much repertoire do I need to bring? Like, what sort of stuff? And obviously, as you say, it starts with a conversation, and usually, even if you don't have that repertoire, we've often got something a little bit like it. But it is something that as a sector that we're a sort of unionised workforce who, in terms of your day-to-day basis, what you're doing are 3-hour rehearsals, quite strict rules, and there is a sort of inbuilt thing around that that players will come to us and they expect that they need to play for 30 minutes, in that session, that you can't stop for a breath. But really, and I sort of kept reiterating, start with a conversation. It's not about what you play. It's about having that interaction. And of course, that's easier said than done. That coming into a hospital environment where some people are at their most vulnerable, and to open up a conversation when you're an external musician coming in, it is terrifying. But equally, that's where some of the most beautiful interactions can happen. But it isn't. It always surprises me how little repertoire we actually play in the end. We sort of think about it a lot, but so much of it just comes down to the conversation.
We have just 2 minutes left, and I've just spotted one very short, quick question. Let's just say that, otherwise we're going to get thrown out. Bad things will happen.
I'll try and be really quick. I just wanted to say hi, really. I'm Claire. I'm a music therapist here, working in paediatrics. So I just wanted to say hi, because there's so much crossover, and it's all about the power of music, and I think the residency is amazing. Too much to say now, but I just also wanted to say I'm currently in a clinical and research role in collaboration with ARU, and Annie here is the Professor of Music Therapy at ARU, Cambridge Institute of Music Therapy Research. We already know Natalie, and we have various conversations along the way, but just to say, I think for the future, there's lots of exciting opportunities, and it would be fantastic to explore those opportunities further. Together or individually, but just being, the power, what the power of music can do. And it was really fabulous to hear your work. Thank you.
Thank you. What a great way to end the session. Thank you so much, everybody, for coming and for your brilliant questions and conversation. And it just remains for me to thank the panel, Akua, Sam, Krissy, Sian, and Bridget, and for all of you for coming. Thank you so much for joining us.